Hi, I'm April with Lira Clinical Skincare, and I am so excited to be here today and introduce you to the Lira Clinical GPS for acne management. When it comes to acne, it's something that I have experienced personally, and it's something that has created challenges for me throughout my life. From the time I was 10 years old, well into my 30s, I was fighting acne. It was one of the main motivators for becoming a skincare professional. And using the Lira Clinical Guide and Protect system, the Lira Clinical GPS, I was able to not only manage and correct my own acne, but to help other skincare professionals do the same for their clients. So what exactly is the Guide and Protect system from Lira? It's a system that allows us to create and identify exactly what the skin needs on a customized basis. That means every single client that we see is going to be addressed on a unique individual level. In our case study for this video series, we have a 17-year-old girl. She has both internal and external factors that are affecting her skin. Her internal factors are diet, nutrition, as well as some hormonal imbalances like polycystic ovarian syndrome, prediabetes. These internal factors can have symptoms that show up on our skin, like acne. Some external factors that we were also challenged with, of course, over 2020, we had to wear masks well into 2021. And so our client was wearing a mask for school, was wearing a mask for work, was wearing a mask anytime she wanted to go anywhere, to the grocery store or anything. So between the internal and the external factors, add a little bit of fear and stress from 2020, and we had the perfect brewing pot to take normally healthy skin and turn it into acne grade 3. One of the most important parts of helping to manage acne is the consultation and the relationship you create with your client. That's why we are going to spend the first video talking about the initial consultation, setting up the client for success through education and gaining their commitment to what they do every single day in order to truly change the health of their skin. When we think of acne, we think of oily skin, we think of buildup of dead skin, we think we need to reduce the oil, we need to reduce the buildup of dead skin through exfoliating and very aggressive treatments. Well, sometimes that can backfire. Sometimes we need to work on the skin in a progressive way and focus on the barrier function of the skin, focus on reducing inflammation in the skin and helping the skin return to a state of health so that we can actually work on those additional symptoms such as excessive oil and excessive stratum corneum in a way that will not further irritate and aggravate the condition. Let's go ahead and meet our client. We'll do a thorough consultation where we identify her individual needs. We will educate her on what she's going to change every single day and the expectation of the series. And we will do a thorough skin analysis and one of Lira Clinical's hybrid treatments.
So to start with, you already are using the Enzyme Cleanser and the Salicylic Cleanser at home, correct?
Yes.
Okay, perfect. So are you doing the salicylic acid in the morning and the enzyme at night?
Yes.
That is excellent because the enzyme cleanser is going to help if you wear any makeup that day. It's going to help remove it. And so that's a great way to do that. Cleanse in the morning, get rid of any oil or anything from sleeping, and then you'll cleanse at night. So remember how we talked about cleansing, you apply it to dry fingertips, massage it onto dry face, massage everywhere, and then go ahead and wet just your fingertips and create that lather right on the face. Once you've done that for about 60 seconds, go ahead and rinse everything with tepid water. Then you're just going to gently pat dry with either a clean soft towel or a white paper towel. So after you have brand new, fresh, cleansed skin, the first thing that I want to come into contact with that skin is called the Pro Lite Serum. The reason I want this directly on that fresh, cleansed skin is because the redness that's getting left over once an acne lesion or pimple heals, that red dot that gets left, it's called post-inflammatory hyperpigmentation. Pro Lite Serum helps to fix that, but it also helps stop it from happening from a future breakout.
Gotcha.
Yeah, so that one goes right on to brand new, fresh, cleansed skin. All you need is one pump on your fingertips and then gently pat it in, roll it in to the skin. Okay. We're being very gentle with everything that we do.
Right.
Okay. The other thing that I really want you to use every morning is the ice balancing lotion. The reason I want you to use this is because it does have the salicylic acid in it, which is going to be very helpful for helping with the breakouts. It's going to be helpful with the oil, and it's also going to help with the barrier of your skin, which your skin has a really large role of really protecting from foreign pathogens. And when it gets damaged, when that barrier and that microbiome don't work, then our skin has a reaction like rosacea or acne, because all of these things that don't play nicely all of a sudden are like, oh, I want to go to there. The Ice Balance Lotion is going to help rebuild a healthy microbiome, and it's also going to help with the oil and the acne control. So this is going to go right on top of your Pro Lite Serum.
Okay.
So really simple. In the morning, you're taking your ice cleanser,
Cleanse, serum, and then the balancer.
balancing lotion, exactly. And then most importantly, and I know you hear me say this all the time, protect, protect, protect.
Right.
So this BB Bright has an SPF of 30. You're going to simply put it on every morning as your final step. I want to show you really quick how I'd like you to use it though. Go ahead and give me your hand. So you're going to do one full pump on a fingertip, okay? You're going to take that fingertip and you're going to dot it around your face. You're going to let it get warm for about 10 seconds. And then you're going to gently massage it into the skin until it has just a beautiful, healthy glow and the skin has absorbed it. So what that's going to do, it's going to do two things. It's going to calm the redness. It's going to give you just an absolute overall beautiful, healthy glow, but it's also going to give you a 30 SPF from the sun. If you're going swimming, like I know you like to do, I want you to make sure that you reapply every 30 to 60 minutes when you're swimming and when you're out in the sun. There is water resistance, but it's not waterproof. So about 30 minutes in, go ahead and hop out, put a little bit more on. It's going to help not just protect from the sun, but it also will help keep that hydration and keep the chlorine from getting in your skin as well. That's your daytime. 4 steps. At night, you're going to do something very similar. You're going to cleanse with your bioenzyme cleanser, just like you're doing. Okay. After you have a nice, clean face, what's the very first thing that should touch your skin?
It's the Pro Lite Serum.
Pro Lite Serum, perfect. So one pump, dot it around the face.
Got it. Massage.
Now, instead of using the ice balancing lotion with the salicylic at night, to start with, I'd like you to use the Biohydra infusion for some added hydration. The reason I'm recommending this is because it's going to help balance the inflammation, plus it also has antimicrobial ingredients. It has colloidal silver and colloidal gold. So your face is gonna be very sparkly. Not really, not really. So once your skin has had a chance to, oh, and you also have your Biohydra C serum at home already.
Right.
So the Biohydra C serum will go right over the top of the Biohydra infusion.
And that's just at night.
Just at night.
Okay.
So for now, you're doing 1, 2, 3, and then your Biohydra C serum. Your Biohydra C serum. This is your nighttime program. In the morning, it's going to look a little different. So at night, it's green, mostly green.
Right.
During the day, we're going to be using the ice cleanser. We're going to be using the Pro Lite Serum. and we're going to be using the ice balancing lotion.
Right.
There's a good chance that once your skin is a little bit less reactive, we can use the ice balancing lotion morning and night. I'd like to see how your skin responds to it once per day. Then there's a good chance we'll probably accelerate to twice a day.
Okay.
Twice per week, I want you to be using the ice refining mask. Now I know you already have that at home, and we did that in your treatment as well today. Your skin responds so well to the detoxifying benefits of the ice refining mask. So just apply it everywhere. Go watch a YouTube video, go wander around, let it dry completely. Once it goes from that gray to the white, that's when you know it's time to re-wet it. So go ahead and get your fingertips wet, get it wet again, turn it back into a paste and not that hard chalk, and go ahead and massage it off and then rinse everything off. So what you'll do is you'll do that at night after you've cleansed. So then you'll just go right back into your normal night routine. Actually, go ahead and cleanse first and then do the mask.
Mask, serum, and then
the Hydra infusion.
right, that one.
And then at the very last thing, to hydrate, Biohydra
Hydrate.
Serum. Perfect. And you know what? Not to worry, because we have this prescriptive pad. I'm going to put your steps in, and I'm going to tell you if you're going to use it morning and night. And then I want to see you again for your next treatment in your series in 2 weeks.
Okay.
And then 2 weeks after that.
All right.
And then 2 weeks after that.
I see a pattern.
I see a pattern. Okay, perfect. So, okay, any questions for me?
I don't think so.
Okay.
Sounds good.
Thank you so much.
Thank you.
Okay, we'll see you next time.
You too.
After completing the skin analysis and performing her first treatment, it was obvious that this client's skin is in trouble. We saw a lot of reactivity during the treatment. The texture, when we were able to get our hands on her skin, was very rough, very coarse, very dry. And even though there's a lot of oil production, the overall texture of her skin is very rough and very dry, which is common when you see acne related to hormonal disorders. We know that a progressive rather than aggressive approach is going to be more appropriate for this client due to her young age, her high reactivity, and her sensitivity. So my goals with her treatment series are to take her through rebuilding her barrier function, helping to reduce the post-inflammatory hyperpigmentation, all the while minimizing and correcting the active acne and helping to prevent the formation of new acne. So join us on our next episode, where we will use the Lira Clinical Guide and Protect system to create a custom treatment series, and will continue to manage her home care.